Coach Tosh is here where careers begin. From zero to coder, she shows the way. Stable income and you work from home all day. Come and share, don't scroll past. Learning with Tash, she's gonna change your path. Tap, 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 let the diamond shine. Build your future, one code at a time. Welcome everyone. ICD-10-PCS. This is just an introduction, okay? What it is. ICD-10-PCS stands for International, look, a coach is looking too. International Classification of Diseases is the 10th revision procedural coding system, all right? 10th revision, guys, all right? Because remember I said before ICD-10 came into activation in the United States of America, we were on ICD-9. Okay, the classification system for inpatient procedures was on the 9th revision. When I first started coding, guys, I came in on 9, so I'm not saying it was back then, but the coders, the inpatient coders that I was blessed to work with, excellent ladies, guys, down here in Atlanta, but they had started when the classification system was 8, okay? So we have evolved, all right, and that's because new technologies too, guys, all right. But I think we're going to be on 10 for a minute, so you guys don't have to worry about switching to 11 anytime soon. Okay, so that's what it is by definition. It's used to code inpatient hospital procedures, all right. Where it is used. ICD-10-PCS is used in the inpatient hospital setting. What is inpatient again? Anytime you spend the night, 24-hour care in the hospital, it's considered an inpatient admission. So this is where we get our inpatient medical coders, all right? It is not used for diagnosis coding. PCS versus CM. PCS is for inpatient procedures. CM is a clinical modification, but it's for diagnoses, okay? ICD-10-CM is for diagnoses. So you're always saying to yourself, okay, what's wrong with the patient? All right? Patient has leg pain. ICD-10-PCS is for inpatient procedures. How are we going to fix it? All right? So this is the logic. Remember, CM, what's wrong, right? Why are you here? ICD-PCS, how are we going to fix it? What do we need to do to treat it, okay? And sometimes treating it or a procedure, I just want to further explain that it may not be taking the patient to the OR. Okay, we have non-invasive procedures, all right? And Coach is just teaching and talking to you guys tonight so you don't feel overwhelmed. Just breathe, and there is a method to my madness, okay? It has been true and tried, and this is the foundation, all right? So for anyone out there that's like, Coach, let's just get to the coding. Let's just get to, nope, nope. Because if a house doesn't have a foundation, it's going to fall. So with everything, you have to take the right steps. You take the right steps, get the right foundation, and you're going to go far in inpatient medical coding, all right? So why it matters. It supports coding accuracy. Hold on, guys. Coach got to get her readers on. That's why I try to bold it. I don't think I bolded this good tonight, guys. Be patient. Okay. It supports coding accuracy. It supports reimbursement. What is reimbursement? How much money the hospital receives for the services they provide. It supports reporting. Remember, there's huge databases in the federal government with the CDC, With the World Health Organization, these codes are captured and they are data driven as well. They know how many people had heart transplants, how many people was on a trait, down to the city, down to the zip code, down to the region. Okay, because of the codes that the inpatient medical coders are coding. They don't look at physician documentation. That is too long. Okay, this is why your jobs will not, and not even your career opportunities will not be replaced, guys. Okay, and the more we get advanced in this, AI is definitely going to be a tool to help inpatient medical coders, auditors, and our CDI department. It will help us, but we still need the critical thinking. All right. All right, it is built for precision and detail. Hold on one second, guys. All right, so I don't have it here, but I want to just talk to the elephant in the room. I know it is, all right? I know a lot of people struggle with ICD-10 in the beginning because it doesn't even look like what you're used to, okay? I just want you guys to know the system is systematic, it's structured, it's logical. It's not based on memorizing a procedure name or assigning a code. However, just like ICD-10-CM, where coach can say J18.9 is pneumonia unspecified. All right, you will learn in ICD-10-PCS that just say 3E0 is the first three characters for your administration of, like, say, a drug, okay, your chemo, things like that. And then you finish the table based on the OT report, okay? You will know a lot of the first 3 or 4 characters just by doing them. Total hit replacement starts the same, 0, the same 3 or 4. I can't run, I'm not going to say rumble off a code or just say it, because this is how the system is. It's very specific. It's very logical. You're going to use the tables, okay? They're not just going to say what body part and you can just say leg. You're going to have to pick the code or the body part that's right leg. What part of the leg, okay? Was it the femur? All right. So it gets very detailed. However, if you have the OT report, that's where you know to look within the OT report or the note and find the next 4 characters. Okay, code structure. Every PCS code has 7 characters. All right. So if you have 6 characters, 8 characters, you're wrong already. Every PCS code has 7 characters. And remember, guys, I told you guys, once we get to like the 6 and 7 places and it's not there, like device and qualifier, we have placeholders. And the letter Z is a placeholder in ICD-10-PCS. Each character has a specific meaning. Okay, so as a coder, whether you're looking to get into inpatient medical coding, if you're looking to even do CDI and you have to learn some aspect of ICD-10-PCS, your mindset should always be this, okay? What was done? Ask yourself, what was done? And I'll get to why later, guys. Why was it done? Okay. How was it done? So the biggest takeaways for PCS for inpatient is, it is inpatient. PCS is for inpatient procedures, okay? Not outpatient, not anything else. ICD-10-PCS is for inpatient procedures. PCS is different from ICD-10-CM. Remember, ICD-10-CM is for diagnosis. What is wrong with the patient? PCS, ICD-10-PCS is what are we going to do about it? If the patient came in with acute blood loss anemia or GI bleed, what are we going to do about it? We're going to find what we're going to do about it in ICD-10-PCS. Okay, it may be a blood transfusion. You see how they're not going to take the patient to a operating room for a blood transfusion, but that is still considered a procedure. What are they doing about the GI bleed? Okay? To admit the patient to the hospital for care, they better do something. Even if they don't do a blood transfusion of some sort, sometimes they'll take the patient to the lab and they'll do like a EGD. Okay? They'll go in and see if they can see what's going on with the patient. Why are they losing blood? Okay? Do the patient have an ulcer? They'll do a workup. All right? PCS uses 7 characters. We'll go through the 7 characters. So remember, it's not 6 characters. It's not 8. It is 7 characters. PCS is built on logic and precision. Okay? And once we look at the tables, as we get further, you'll see the logic and the precision to detail. But again, it's nothing. Like I tell you guys, you don't have to diagnose a patient. That is the responsibility of that attending physician. Okay? And you do not have to make up things in PCS. If the OT report or the procedure is not clear, then again, we send a query for clarification. All right? Our jobs or our responsibility is to translate diagnoses or patient documentation into alphanumeric codes. And if it's not given, then we query. That makes our job a lot easier, guys, all right? Or a lot less stressful. Remember, root operations are a major PCS concept. Major, all right? And you'll see why in a minute. Okay? Each character and the 7 character, guys, has a specific meaning. That means every part of the code is there for a reason. All right. And remember, you are building a code based on documentation and based on the details of the procedure. Okay. So that makes it easier. So you always want to stop thinking only in terms of procedure when we're coding. Okay. Instead, you want to ask yourself what was actually done. Okay, what body system is involved? What was the objective of the procedure? How was the procedure performed? And I know coach is talking fast, but I have to break. I'm saying it, but I know I'm going to break down each of these pieces to you guys. Okay, root operator, 3rd character. We'll talk about that because that's very important. All right. So I know, and Shar, I know this might feel like a lot, and it's okay. It felt like a lot to us when we first got the system, but it's not. I'm going to teach you guys how to use the books and how to follow this logically. All right? Like medical coding, anything, it's a skill. So it's going to take practice, but the more you do it, the better you get. Okay? Remember, you do not have to master it all one time. The key that coach wants you guys, I want to teach you guys the logic of the system little by little. Once we have that foundation, we'll start understanding the procedures in a much stronger way, okay? So if you remember anything that coach went through tonight, remember this, ICD-10-PCS is inpatient. It's for inpatient procedures. It's built on structure, logic, and precision. Okay? Let me show you guys something else. Okay. I just want to go through an example before I really break down all the approaches and that's percutaneous. We'll talk about one tonight. I think Fee had asked me to start doing approaches. We'll start the approaches and then I'll move into the root operators. All right. This isn't bolded. Can you guys kind of see this a little bit? Okay. All right, so I'm not going to start with root operators. I'm going to start with approaches, and we're going to go through one approach tonight. There's 7. All right. So grab your paper and your pen, and we're going to go through approach number 1. This is open. Coach will read this just in case you can't see it, all right? Because I do use this. I've been teaching this for a minute, so I didn't have a chance to go in and bold it. Actually, I didn't want to bold it, so just bear with me here, okay? ICD-10-PCS is 7 characters, all right? Approach is our 5th character device. The official definition is cutting through the skin or mucous membrane and any other body layers necessary to expose the site of the procedure. So open is kind of easy for us to determine. All right. Usually we're going to see some type of cutting device like a scalpel. All right. They're not going to say knife, but we're going to be able to see that the skin was cut. All right. The layers of the skin. You'll see skin, subcutaneous, fascia, muscle, bone, words like that, guys, all right? Excuse me. So the character value for open is always the 0, okay? So we're looking at 7 characters. The 5th character, if the procedure was open, will be represented by 0. So open means they made an incision, they cut through the skin to expose the site. Think of it like opening a door. You cut through the skin and see everything directly. Think of it as opening the door, guys, for open. This is the most straightforward approach. I think that's why Coach always decides to start with open. A big cut, direct access, direct visualization, okay? So they can see straight in. They open the door by using that scalpel. The size of the incision doesn't matter if they make a 2-inch incision or a 12-inch incision, okay? 2-inch is little, 12-inch is like a ruler. It doesn't matter. They cut, you'll see the terms cutting through the skin like a scalpel, okay? Look for words like incision was made. Where's my pointer? Incision was made, the abdomen was opened, a sternotomy was performed. All right, so remember when we go through medical term and you learn otomy is incision into, okay? Stern is a bone. The sternum is right here in the front of our chest, okay? So they're opening that patient up when they do a sternotomy. All right, here's a sample OT report. Let me try to blow this up, guys. And like I said, this is de-identified and I'm not giving any medical advice. This is all for education, guys. Let's just get to it. OT report, you'll see a procedure, open cholecystectomy. We know that they're surgically removing, ectomy, the gallbladder. Cholecyst, okay? You'll see a pre-op diagnosis, acute cholecystitis with cholelithiasis. Remember, this is your ICD-10-CM, all right? What's wrong with the patient? What does the patient have, all right? PCS is what we're doing about it. This is what they're going to do about this diagnosis. They're going to remove the gallbladder. Post-op diagnosis, you'll definitely see same, or, the transcriptionist will completely write the diagnosis again here. Anesthesia was general. Remember, in inpatient coding, we do not code the anesthesia, guys. When I started coding, I was coding the anesthesia, all right? So, but you guys are not going to code anesthesia. All right, description of the procedure. Coach is going to read this, ad-lib this for you guys, okay? The patient was placed in the supine position After induction of general anesthesia, the abdomen was prepped and draped. Okay? And I like to kind of sometimes visualize what's going on. I remember when I was coding, it would definitely help me. All right? So, supine position. If you guys are blueprint students or nursing background or coders, you know they laid the patient on their back. Okay? A right subcostal incision was made through the skin, subcutaneous tissue, and anterior rectus sheath. So you guys see, they made an incision through the skin. All right, this is layers of the skin. Subcutaneous tissue. So here is your indication that this procedure, not only did we see it in the title of the procedure, sometimes we can get it from the title. However, as inpatient coders, we do want to look in the procedure, the description, the body of the procedure, and make sure. All right. And we'll see that example later, especially once I get to telling you guys about the root operators. Because the physicians will put one thing and they will do entirely something different as far as approaches go, or the root operators in here. Okay. Okay, where were we at? Okay, they cut the muscle on the stomach. See, they went through the rectus muscle. It was divided. So right there, you like, dang, they divide muscle. This is open. It's not closed because it's seven approaches. So you guys can weigh it like that. They didn't use a scope. Well, we haven't went through laparoscopic, so coach not going to get ahead of herself. Okay, the peritoneum was entered. The gallbladder was identified and noted to be inflamed and distended. The cystic duct was identified, clipped, and divided. The cystic artery was identified, clipped, and divided. The gallbladder was dissected from the liver bed using electrocautery. The entire gallbladder was removed. Hemostasis was achieved. They stopped the bleeding, guys. Okay, hemostasis. The abdomen was irrigated. You know, they use some fluid and liquid to clean it out, all right? Because they have blood in the cavity. The abdomen was irrigated. The wound was closed in layers, all right? This is another indication. They closed the wound up in layers. This patient was opened up. The patient tolerated the procedure well, okay? I always try to remember where I was when I started doing inpatient, because Coach read all of this, all right? So I want you guys to know I started not knowing anything, and you read all of that, you're like, how do I know what to code? Do I code that the cystic duct was identified, clipped, and divided? No. You just ask yourself, damn it, they're going to have to do that to get to the site that they're trying to get. We can't just code everything they do inside. That's part of, all right, their job or their day, all right? That's just part of it. The objective of the procedure, or the objective of this procedure, was to remove the gallbladder. Okay, so we don't want to code other things that they did to remove the gallbladder. All right, they would have to cut arteries that were around the gallbladder to even get to it. So we're not coding that. That's not a procedure. Okay, it's almost like, thank you, Holy Spirit. It's almost like the mechanic taking your tire off and we're coding that they removed the nuts and the bolts. No, that's a part of him having to remove the tire. Okay. All right. Code build walkthrough. Put a 1 if you guys are following me. I do not want to get that. Hey, Alicia, welcome in. The puzzle piece, guys. Put a 1 if you guys is following Coach. I don't see nothing. You guys in the room? There we go. There we go. All right, let's go. Listen, now this is how we build. Even though I haven't talked about the 7 characters, right? We are talking about ICD-10-PCS, and I'll talk about the characters, but I want you guys to see it. See an example every night. Like I said, this is going to be a series. We're going to do this for the next 3 weeks, okay? So listen, there are 7 characters in ICD-10-PCS. The beginning of the book is the alphabetic index, okay? The second part of ICD-10-PCS is what we call the tables. All right. So 7 characters. Count with me. 1, 2, 3, 4, 5, 6, 7. Remember, Z's are placeholders. All right. Let's code this procedure. The procedure was an open cholecystectomy. What section? The first character is asking what section. 9 times out of 10, a lot of our, well, not even 9, maybe I'll say 70%, right? If they take the patient to surgery, the value is 0. That's medical and surgical. What body system? You just refer back to the OT report, all right? The body system is hepatobiliary system and pancreas. Coach, how do I know how to choose that big old word that I don't understand? Because when you have your book, you're going to have different body systems. You know it's not respiratory system. You know the gallbladder is dealing with the digestive system. Or you know that this is liver, biliary system, and pancreas, all right? It doesn't have to be these words. This is just a part of the system. See the word system? We haven't gotten to body part. This is the system, okay? That is represented by the value F. So right now we have 2 characters. And Coach hasn't even gone through the book. I'll show you guys when we go through the book and we look up cholecystectomy, the alphabetic index is going to give us the first 4 of our characters. So if we use the book and look up cholecystectomy, next to that, we're going to see OFT4. So we only need to go reference the table in the second part of the ICD-10-PCS book, and we have to build the rest of our code, all right, based on our OT report, all right? So we know medical and surgical was the section because they took the patient to the OR. Body system, F for hepatobiliary system and pancreas. Third character, here's our root operation, guys. This is where 80 or more % of our errors occur. The root operation is the intent, the objective. When they took that patient to the operating suite, what did they want to do? What did they want to do? They wanted to remove a whole body part. The definition for removing a whole body part, a gallbladder is a whole body part. That is represented by the root operated resection. Entire gallbladder removed. In the book, when you're building the tables, it is represented by the letter T. Body part. For body part, you're going to get a lot of body parts, okay? That is included in the hepatobiliary system. You might get pancreas, right? Cystic duct, all of that stuff. But you're going to go and look for, okay, I'm asking myself, Tosh, what body part did they entirely remove? Oh, okay, let me look down. 1, 2, 3, 4. Oh, the number 4 is saying gallbladder. So I choose number 4 as my 4th character in my 7-character code. I'm building a block. The 5th character is approach. It's asking, how did the surgeon reach the site, reach the gallbladder? All right. We're talking about open today. I'm not going to go into the other approaches tonight. I want you guys to see open. Open is represented by the 0. I have to remember that it's 0, guys. We hardly look at O's unless we're doing something else, okay? But open. An incision was made through the skin to expose the surgical site. This is the definition of open. It exposes the surgical site, open. Device, and we'll learn our definition. Device is asking, well, you know what? In this particular code, it's just Z, no device. Okay, but the definition of device is if something was left after they closed the patient up, Did they leave something in? And usually we see devices like pacemakers, guys, like if they put a coronary stent in the patient, all right? But when you're using your book, you're not going to get any other choice but Z. So that's easy. You're not going to say, I'm just not going to put a character for the 6th character because coach said that it would be wrong. If the code is not 7 characters, it's automatically inaccurate. Qualifier, again, you're going to see the letter Z for no qualifier. So this is your code. Final code, 0FT40ZZ. Coach's teaching tip. If they cut through the skin to see and touch the surgical site directly, it's open. Period. If they cut through the skin to see and touch the surgical site directly, it's open. I'm laughing at my own notes, guys, because I put the word period. And I'll probably do some translating with talking into my my computer or my phone, and then I'll print it out so it's everything here. And remember, laparoscopic assistant procedures where the main work is done through the incision are coded as open, not percutaneous endoscopic. And I'll show you guys an example of that later. So, okay, this is percutaneous, but we will talk about percutaneous tomorrow. Today was open. I will get a little deeper over on YT for open to help you guys. But for now, I wanted you guys to see the approach of open. That is represented by the 5th character, right? In ICD-10-PCS. All right, so if you guys clearly understand open much more than you did when you came in the room tonight, give Coach some hearts. If you did not, let Coach know that too. But PCS is logical and it is a system, guys. I actually really enjoy it, right? And it is very much doable. Let me turn this light on. It is doable and people are using it. We have an encoder system. The book is very logical. It's just you understanding the root operators and the approach values, guys. And that's what we're going to talk about.